Hey, Dr. Derek Nielsen here. I'm the owner of Kaizen Physical Therapy here in Durham, North Carolina. Today I want to talk about healing, pain, and injury. And I want to talk about why they are completely independent of one another. I had a potential patient reach out to me, and she was talking about a torn meniscus that she had been diagnosed with years ago. She had osteoarthritis, degenerative disc disease, and I believe she also said that she had a torn ligament. But she thought this was the cause of her pain, even though she'd been diagnosed with it years ago. So here's the thing you want to remember, is that healing doesn't always mean that the area of the body looks brand new. So healing is a response of the nervous system. So when your nervous system says that your body is healed, then it stops sending inflammatory signals. And it says, hey, this area of the body, it passes it, it's checked, it's okay, it's not a problem anymore. That doesn't mean that when you go and take an X-ray or an MRI, that area of the body is going to look brand new. That just means that your nervous system is okay with it. It doesn't perceive that there is a threat. And that's the key point here, is that healing doesn't always mean that it looks brand new on an X-ray or an MRI. Because you can't see pain on an X-ray or an MRI. And before I forget, I wrote this book for you. Please go get it. It's completely free for download. I don't even need your email address. If you just go to thepainreliefbook.com, you can download it for free without inputting your information in. It'll help you understand a lot of this and plenty more about how to find a long-term solution to your pain. So, healing doesn't mean something looks completely brand new. And that's a key point, because we can go and look at an MRI or an X-ray and say, hey, your knee looks like it's bone on bone. You don't have any cartilage. But that doesn't necessarily mean it's the cause of pain. It's the nervous system. It's its responsibility to decide if there's a threat. If the nervous system thinks there's a threat, then that will cause pain. If the nervous system doesn't think there's a threat, then it's unlikely to be the cause of pain. And the cause of pain is something else. So how do we begin to tell if it's something else or if it's the damage? That's the question. The answer to that question is, I want you to think about this. When did the pain initially start? How long has it been going on? Did it start from an injury? Was it longer than 6 to 8 to 12 weeks ago? After 12 weeks, your body should be healed. And the pain that you're feeling after 12 weeks from an injury is extremely unlikely to be the injury itself. It's because your nervous system still perceives there to be a threat, and we have to find a way to reset the nervous system, which can be massage, it can be myofascial release, it can be dry needling, acupuncture, some hands-on manual therapy. Heck, it can even be some exercise. We've got to find a way to reset the nervous system and quit firing and thinking there is a threat. We don't need to go in there and surgically replace a joint or figure that because something looks funky on an image, that's the cause of the pain. The far majority of the time, it's not, especially if your pain's been going on for 6 to 12 weeks or 8 weeks. The body has likely healed, and it just needs a nervous system reset. So this is key, because if you have an injury, healing doesn't always mean that the body part looks new. Healing means the nervous system does not perceive there to be a threat. And if the pain has been going on for 8 to 12 weeks after the initial onset of pain, the likelihood of the damage or the injury itself being the cause of the pain is extremely low. The nervous system still perceives there to be a threat, which means we have to reset the nervous system, and there's many ways to do that. Again, go get this book, read it, educate yourself about healthcare, educate yourself about your body, and start finding a long-term solution to your pain. Get it free for download. I don't even need your email address. That's how much I want to help you and educate you. I don't need anything from you. Just read it. Go and find it at thepainreliefbook.com. Thanks so much.